About a bruising week last week for the European Commission, which sort of fumbled and gaffed its way through this fight with AstraZeneca. But as you say, AstraZeneca has now announced that they'll give an extra 9 million doses, taking the total up to 40 million for the first quarter. And now Pfizer BioNTech says that they'll be able to bring forward a delivery of 75 million doses in the first quarter. So it's starting to look like there's going to be some more vaccines filling the syringes of national health systems around the European Union. Initially, they were accused of being slow in their deliveries, and there have still been some problems in the national health services around the European Union. But largely now the question has been about how many doses have been available. So these new doses that they can announce, that they can say that they are going to be able to be delivered sooner than expected, or at least sooner than expected after the delays that were announced after they were agreed, is some positive news after this very, very difficult week for the European Commission last week in its fight with AstraZeneca and in the criticism over its vaccine rollout.
Absolutely, Jack. So this is welcome news. But let's just look at the situation on the ground right now. In terms of vaccines, how does the EU compare to the front runners like the UK, like Israel, like the US?
Yeah, well, they're struggling, aren't they, Isabel, to be fair. A lot of countries are now starting to move. We're seeing sort of Malta and Denmark head over the 5% of their populations being inoculated. But at the moment, still, the European Union is yet to breach that 3% of the population mark. And this means that there's a real long way to go before 70%. When you compare it, as you were talking about before, with the United Kingdom, which is getting up towards a sort of 12% of the population mark for the first dose. So there is still a long way to go. There's a lot of pressure on the health systems to work faster, but there's also a lot of pressure on the drug makers and on the European Commission's purchasing programme to act quickly to get these jabs out as soon as possible.